Hi, my name is Ginger Barnes, and this is my head-to-toe assessment for FMP1 Fall of 2024. We'll begin by scanning the room. All of my instruments, ceiling, floor. Okay. There we go. Okay, so throughout the exam, we'll be assessing for skin. We'll be looking at skin's color, texture, moisture, looking for any bruising, scarring, rashes, lesions. We'll begin by assessing the head, and I'll be palpating the scalp and looking for any masses or tenderness. I will also be inspecting for hair distribution, color, looking for any infestations. So we'll start by assessing the head, and I'm looking for symmetry and midline position. I will be assessing temporal artery and lymph nodes, starting with submental, submandibular, tonsillar, occipital, preauricular, postauricular, anterior cervical, posterior cervical, and supraclavicular. Now I'll also be assessing for cranial nerves 5 and 7, and I will be doing this by asking him to clench his jaw and checking the masseter muscle. I will also be checking TMJ while I'm here by asking him to open and close his mouth. Good. Be using a cotton ball to assess for light sensitivity. If you will close your eyes and let me know where I'm touching.
Forehead, left cheek, right cheek, nose, chin.
Good. Now, I'll also be assessing for cranial nerve number 7, which is looking at facial. So I'll be doing this by asking you to smile, frown, raise your eyebrows, puff out your cheeks, and pucker your lips. Good. Now I'll be assessing the ears. So we'll be palpating the pinna and the tragus, looking for any tenderness or masses. I will be using the otoscope and assessing the auditory canal. I will also be looking at the tympanic membrane, seeing that it is pearly gray. Now I will also be assessing for hearing using the tuning fork. We're going to be doing a whisper test, the Weber test, and the Rene test. Let's turn this way. Turn this way a little bit. Okay. And with the tuning fork, well, let's start with the whisper test. So with the whisper test, I want you to cover your ear, and I'm going to whisper something to you. I want you to let me know what I say.
ABC. ABC.
Good. Now for the Weber test, I will be using my tuning fork, and I want you to let me know if you hear this the same on both sides, or is it different?
Same.
Good. Now for the Rene test, I will also be using the tuning fork, and I want you to let me know when you stop hearing it.
Stop. Stop.
Good.
Stop. Stop.
Good. Now moving on, we'll be assessing the eyes. We're looking for, looking at the eyelashes, the eyebrows, palpable fissures. I'll be looking at the sclera and the conjunctiva. I'm looking for any discoloration, lesions, or discharge. We'll also be assessing cranial nerve number 2, which has to do with peripheral vision. So I'm going to come around behind you. And I want you to let me know in your peripheral vision when you see my hands.
Right. Left.
Good. Now I'm going to be using my pen light, and I'll be checking for pupillary response. Good. I will also be checking for your other pupil here. Good. Good. All right. I'm also going to be checking for accommodation and convergence. If you'll look at my pen light. Good. Now I'm also going to use my ophthalmoscope, looking for red reflex and internal eye structures. Good. Now moving on, I'm going to be assessing your nose. So I'll be looking for midline position and symmetry. I'm also going to be checking for nasal patency. Good. Be checking for cranial nerve number 1, which is sense of smell. And close your eyes and tell me what you smell.
Alcohol.
Good. I'm also going to be palpating the maxillary sinuses. All right, and then I'll be moving on frontal and maxillary sinuses. Moving on then to assessing the mouth, the lips, teeth, gums, buccal mucosa, soft palate, uvula, posterior pharynx, and tonsils. So if you would, give me a big smile. Good. I want you to open your mouth and say ah.
Ah.
Good, good. Now I want you to stick out your tongue. Move it left, move it right. Okay, good. We have soft palate and uvula rise symmetrically with phonation, and tongue is midline without fasciculations. Now I'll be assessing the neck. Okay, be making sure that trachea is midline. I'll be assessing thyroid gland by asking you to swallow. Good. I'll be checking the carotid arteries. And I'll also be auscultating the carotid arteries using the bell of the stethoscope, listening for any bruits. So I'm just going to ask you to hold your breath. Good. I'm also going to move on to assessing the posterior and anterior chest. So at first we're going to be looking to see if there's any obvious signs of respiratory distress. I'm looking for any tripoding, use of accessory muscles, retractions, nasal flaring, cyanosis. So if you'll turn around a little bit. There we go. So I'm going to be checking for symmetrical chest rise. And take a deep breath for me. Good. I'm also going to be assessing for symmetrical tactile fremitus. And to do this, I'm going to be asking you to say 99.
99. 99. 99.
Good. Now I'm going to be listening and auscultating for all of the breath sounds and intercostal spaces. Starting above the scapula, take a deep breath for me. Good. Trying to get right middle lobe and lateral. Good. I'll also be assessing for egophony, bronchophony, and whisper pectoriloquy. I'll be doing this, again, I'll be listening for all the breath sounds, but this time I want you to say 99.
99. 99. 99. 99. 99.
Now for bronchophony, we're going to do this again, and I'm going to be listening. This time I want you to say E.
E, 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 E.
Okay. And for whisper pectoriloquy, I'm going to be listening again, but this time I want you to whisper 99. Okay, good. Now moving on to anterior chest. You can turn around this way a little bit. All right, so I'm going to be again assessing for symmetric chest rise. So take a deep breath for me. Good. And I will be assessing for tactile fremitus on anterior chest as well. Let's say 99.
99, 99, 99.
Good. I'll also be auscultating breath sounds in the anterior chest. Good. Now I'll also be auscultating for heart sounds. I'll do this with the diaphragm of my stethoscope and the bell of my stethoscope, and I will be auscultating in all 5 points. We will begin with the aortic valve, which is second intercostal space to the right of the sternal border. Pulmonic, which is second intercostal space left of the sternal border. Erb's point, which is third intercostal space left of the sternal border. Tricuspid, which is fourth intercostal space left of the sternal border. And mitral, which is fifth intercostal space mid-clavicular line. I'll be doing this again with the bell of the stethoscope, aortic, pulmonic, Erb's point, tricuspid, and mitral. I will also be feeling for point of maximum impulse, and then I will also be listening for the apical pulse for 1 full minute. Good. Now, at this point, I will ask him to lay down. Okay. Now, laying down, I will be looking, usually I would have him at a 30 to 45 degree angle. I'm looking for any jugular vein distension or pulsations. I will also be auscultating the heart in all 5 points again. And I will also be observing for any heaves or lifts and palpating for any thrills. Aortic, pulmonic, Erb's point, tricuspid, and mitral. Okay. Aortic, pulmonic, Erb's point, tricuspid, and mitral. All right. Good. Now, moving on to the abdomen, I'll be assessing the abdomen for any curvature. I'm looking for any obvious deformities. I am going to be assessing the skin as well while I do this, and I will be listening at this point for the aortic, for the aorta, the renal arteries, iliac arteries, and femoral arteries. I will also be listening for bowel sounds in all 4 quadrants. I will be percussing the abdomen. Good. And then I'll be palpating the abdomen for any tenderness or masses. And then I will be palpating further for the liver and the spleen. Okay, good. You can go ahead and sit up. All right, so now I will also be assessing for any CVA tenderness. You can turn around just a little bit. There you go. Good. All right, now you can turn back this way. Okay. So now moving on to musculoskeletal, I'll be assessing the joints in fingers, wrists, elbows, and shoulders. I'm looking for any redness, tenderness, swelling, deformities, nodules, crepitus. I will also be assessing capillary refill and radial pulse. Good. I want to also test the strength. So squeeze my hand real good. Good. And test the strength of triceps and biceps. Push back against me. Good. And pull back. Excellent. I will also be assessing range of motion. So with your fingers, we're going to do flexion, extension, hyperextension, and then abduction and adduction. Good. Now I want to see rapid finger movements. Good. This will also test for cerebellar function and rapid hand flip-flop. Good. We're also going to test range of motion of the wrist with flexion, extension, hyperextension, rotation. Good. I also want to test for radial deviation and ulnar deviation. Good. We're also going to look at range of motion for the elbow. So flexion, extension, hyperextension, and then we're going to do range of motion for the shoulder. Okay. So flexion, extension, hyperextension, and then external rotation, internal rotation, and circumduction. Good. I'm also going to test for cranial nerve number 11 in the shoulder girdle I want you to raise your shoulder, shrug your shoulder against resistance. Good. All right. Now, moving down, I will also be looking at the toes, ankles, knees, and hips. First, I'm going to test for deep tendon reflexes. And I'll be doing this brachioradialis. Go. Biceps. Go. Just let your arm go. Triceps. Good. And then I'll be testing the patellar reflex. Good. Achilles. And then I'll be checking the Babinski. Good. All right. Now, starting with the toes, I'll also be checking capillary refill down here, along with dorsalis pedis and posttibial pulses. I will also be checking for strength of the ankles. So I want you to press on the gas pedal, pull up, good, and testing of strength of the knees. So push back, good, and pull back, good. Testing strength of the hips. So I want you to push your knees out, good, and pull in, good. Now I'm looking at range of motion for the toes. So I want you to squeeze your toes together for flexion, straighten them out for extension, lift them up for hyperextension. Now I want you to flare your toes out for abduction and put them back in for adduction. Good. We're also going to be testing range of motion for the ankles with plantar flexion and dorsal flexion. So I want you to point your toes down and then pull your feet up. Good. Then we're also going to test once you go in for inversion, out for eversion, and then rotation. Good. Now we're going to test, I want you to go ahead and stand up. We're going to test range of motion for the hips. And we're going to do this with flexion, extension, hyperextension. Good. Now, internal rotation, external rotation, and circumduction. Good. Now with the knees, so flexion, extension, and hyperextension. Good. Now I'm also going to check for the spine. So I want you to bend over. I'm looking at the spine. I'm looking for any scoliosis, misalignment, any tenderness. Okay, you can stand up. We're also going to be testing for lumbar and cervical spine range of motion. So for that, once you bend over for flexion, extension, hyperextension. So lateral, then to the side, and then rotation. Good. Now for cervical spine, flexion, extension, hyperextension, and then lateral and rotation. Good. We're also going to be checking the Romberg test. So I want you to stand with your feet shoulder length apart. Put your arms out, close your eyes. We're checking for balance. Good. Now I'm also going to be checking for gait. So I want you to walk over there a little bit regularly and then walk back to me 1 foot in front of the other. Good. Now I want you to hop on 1 foot. Good. And this concludes my assessment.